Chapter 13, Health Problems of Toddlers and Preschoolers. So sleep problems are real common during this age. Kids hate to go to sleep. One recommendation is getting a bedtime ritual, something that allows the child to know bedtime is coming and it slows them down. So screen time is not good. A bath, a book, a snack, something that kind of is calmer, slows them down, and then they know this means bedtime is getting close. Two other sleep problems that are common are nightmares and sleep terrors, and these differ in that nightmares happen during REM sleep. This is an actual dream. The child wakes up frightened, usually cries out for the parent when they wake up, and they want the parent to come in, hold them, reassure them, calm them down. Night terrors happens in non-REM cycles. It's in deep sleep prior to the REM cycle. The child yells and cries, sometimes thrashes around in their sleep, but they're not awake. And when they wake up afterwards, they don't remember it. So the recommendation with this is just to watch the child, make sure they're safe, because they sometimes do thrash around. Don't let them injure themselves. But usually nothing else is needed because they don't wake up and they don't wake up frightened, needing reassurance. Skin disorders are common during this age. Contact dermatitis is from something touching the skin. It can be from plants, from soaps, from furs or dander of pets. The most common is irritation in the diaper area, and this can be from a brand of diaper, a brand of wipes, and it's usually where it touches the skin. So around that elastic around the legs, where it's tight around the waist, the more it touches the skin, the more you're going to get that irritation. Soaps can do it. Certain laundry detergents people will react to. The goal with this is to figure out what's causing it and then stop using that. Usually it's something that will clear up once we stop using it, and just a nice hydrating lotion will help to clear up the dermatitis more quickly, but usually nothing is needed as long as we stop using the irritant. Bites and stings are in this chapter. So our goal is always going to be to prevent bites. So if you're in an area with mosquitoes, for us that's morning and evening that the mosquitoes are out. So stay inside during that time. Or wear long sleeves, long pants. Don't have skin exposed during that time. Bug spray with DEET in it to prevent ticks and mosquitoes and things if you're going to be out in the forest where ticks are, or out during the times that mosquitoes are active. Most bites and stings can be handled at home. We do have Lyme disease in our area from ticks, but it's not something where you've got to get to the emergency department right away, assuming you remove the tick yourself. Just be sure you get the head too, because it's easy for the abdomen to break off and leave the head in. But remove the things yourselves, and then ticks you should be checked. The things where you really should go get emergency care are black widow spider bites, brown recluse bites, both of which are in our area, and then scorpions. And I don't think there are scorpions around here. But if you're in a different area that has them, that's something that a child should also be taken to the emergency room for. Bee stings, the longer the stinger is in, the more venom is getting into that child. So you do want to get the stinger out as quickly as possible. They're kind of barbed, sort of like a fish hook, so they're not that easy to get out. So you do want to make sure that you get it out. My recommendation is a credit card. Use the edge of a credit card, and you can kind of push down deep, and then you run it underneath it, and that will often pop it out. Otherwise you need to get tweezers or something where you can grab it and pull it. And most people are not allergic to bee stings, so just treating comfort at the site, ice or if you do swell up a little bit, some Benadryl for that. But if you have an anaphylactic reaction to bees, wasps, you need to carry an EpiPen, and that should be given to the child right away if they get a sting. Other bites are often from pets, the most common being dogs. Can be the family's dog or a neighbor's dog. Any wounds on the skin, we want to wash them well with soap and water. Things that are deep may need to be irrigated with normal saline or lactated ringers. If the child is due for a tetanus shot, that should be given. If this is possibly a wild animal or an animal that has not received rabies shots, then rabies needs to be considered. Depending on how deep it is, antibiotics might be given prophylactically. Puncture wounds, you break the skin and push germs in, and they really don't bleed much, so you don't get those germs pushed back out. So sometimes prophylactic antibiotics, and unfortunately sometimes these dog bites really do a lot of damage, and the child will need reconstructive surgery afterwards. Human bites also, wash vigorously with soap and water. If it's large, it needs medical attention because you may need some antibiotics to prevent infecting. Burns get covered extensively in fourth semester, so we're not going to do much on burns here. The things I would like you to know, you're going to learn about the rule of nines, and that does not work on infants and children. Their bodies just are proportioned differently, so the rule of nines does not work for estimating body surface area that's been burnt. In emergency care, look at that little box. It says stop the burning process. That's the first thing we want to do. For cool burns, we're going to apply cool water. Running cool water is great for things like sunburn, or if a child touches something hot. Sunburn, I would like you to know about. Unfortunately, sunscreen is not recommended for children under 6 months. But I guess the good thing is children under 6 months are not mobile, so you can keep them under your umbrella or under some sort of a shade. So try and prevent sunburn. And those infants who we can't apply sunscreen, let's keep them out of the shade. If they are going to be out, get a hat on them and lightweight clothing to cover the skin. They may look cute in that swimsuit, but you don't want them burning. Older kids, frequent application of sunscreen. The higher concentrations don't really make that much difference because it wears off before you can have any difference between 30 SPF and 50 SPF. So it's frequent reapplication. Ingestion of injurious agents. This happens primarily with kids under 6, and I would say primarily your toddlers and preschoolers. And they rarely are trying to eat poisonous things. They don't know what it is. They see the little red things that look like candy that happen to be grandma's pills, or they see something sitting in a cup and drink it, and it turns out it was a poison that had been poured in the cup to use, I don't know, on working on the car or something. So prevention here means leaving things in their containers. Don't put them in a container that a child doesn't realize is poison. And have those child safety locks on your cupboards. Put things in cupboards that children cannot get to. If you do have a child who ingests something, the first thing to do is assess the victim. Get their vital signs. Are they breathing? Is there immediate treatment that's needed? And then be sure you terminate the exposure. So if they have pills in their mouth, get those pills out of the mouth. If they've inhaled something, get them out into fresh air. Find out what they took and call the Poison Control Center. We used to recommend syrup of Ipecac, which induces vomiting. The problem is if it was corrosive going down, it's corrosive coming back up. So don't do that. Call the Poison Control Center, and they will, based on that poison, make a recommendation. but our best thing is always going to be to prevent. So locking things up, keeping child protective caps on, don't put things in other containers, prevention. Heavy metal poisoning. Mercury can happen, but the common one is lead. And most of the time it comes from lead-based paint in older homes. Lead is also out in the soil, in contaminated soil, and can be in food and water, including some old pottery. Some folk remedies have it. It's a bigger problem in impoverished areas and urban areas, and that tends to go with the old paint, older rental homes. It can be ingested, but can also be inhaled. So if they're doing construction on an old home that had less lead-based paint, now you have that lead-based paint floating around in the air. So you've got to be very careful doing construction on a house with old paint. So what is the problem? Lead poisoning really affects every system. The problem is you don't see the effects usually until you see it on the neurologic system, and once you see neurologic damage, it is permanent. You can't change it. So it does affect the bone marrow, which will make you anemic, and renal. It basically affects every system, but the big problem is the neurologic damage is permanent. So we check blood levels, and we want a sample that's very low. If it's 10 or above, we consider it a problem. There are stages of where things are done at. And so if it's 10 or above, they start monitoring the child. They start looking at the house to figure out where they're getting it from, because we don't want to continue the exposure. If it's high enough, then we'll treat it. But even at a level where we may not be treating it, we're going to look for the cause and try and eliminate that. Screening is recommended at ages 1 and 2 because this is where kids are most at risk for neurologic damage, and the damage is permanent, and you're not going to see any symptoms until you start seeing that damage. If we do have to treat it, what we treat it with is a chelating agent, which is chelation therapy. It's just a little schematic showing how it really does affect every system. And, whoops, I thought I had a slide on chelation. Chelation is something that binds with something in the body so that your body can eliminate it. Your body really does not have a way to get rid of lead. It moves from the bloodstream into the tissues. So the chelating agent will bind with it in the bloodstream and allow the body to get rid of it. Then what's in the tissue will move into the bloodstream. So it often will take more than one time of the chelating agent. There's PO and IV chelators. It just depends what the doctor orders. But often it takes more than one treatment to even see those lead levels come down. It is good news if we catch it and start treating it, because what had settled into the tissues is now moving into the bloodstream where we can get rid of it. We can't bind it when it's in the tissue. So now moving on to child maltreatment. The most common type is neglect, as opposed to physical or emotional or sexual abuse. So neglect can be physical neglect, not providing food, shelter, supervision, education, or medical care. It can also be emotional, not giving attention or affection, or emotional abuse is intentionally trying to destroy or impair a child's self-esteem. Physical abuse is deliberately inflicting physical injury on a child. Now, not every state has the same definitions for physical abuse, so we can't, there isn't a universal definition. And I think this is a good spot to stop.